Hi, I'm Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I'm an accredited liposuction doctor and medical aesthetics doctor based in Singapore. I've been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for Visa liposuction, and Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift, and also under Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Well, acne or pimples is a very common condition affecting our populations in Singapore, especially under our hot and humid weather, with a lot of oily sebaceous secretion. So what's the difference between acne and pimple? One is just a bit more medical term, the other one is a more layman term, but they're essentially the same. I'm going to briefly discuss about types of acne, the causes of acne, and how we generally tackle it. There are types of acne, we call it comedones or block pores. So it can be white comedones or black comedones, which just means that either the pores, the comedones are completely closed, which is white, or the tip of it is open and hence lead to oxidization and appear to be a bit black, which is blackheads. So they're basically block pores. If the block pores are inflamed, then we can lead to what we call inflammatory acne. And the types of inflammatory acne varies on size. Smaller ones are the papules and pustules. The bigger ones are the nodules and cysts. And obviously the bigger ones, such as nodules and cysts, once it's inflamed, and then even when it's healed, it's going to lead to a bigger scarring compared to smaller ones. And there are many causes of acne. Typically, when I discuss acne with patients, we usually tell them what are the causes of potential pathology of acne and the causes that lead to the pathology of acne. First of all, acne is caused by accumulations of dead cells, skin cells that clogging up your pores, and hence the secretions are blocked, leading to comedones and of course leading to inflammation and so on and so forth. So any kind of blocked secretions due to various cells or debris that are clogging up the pores will lead to acne causation. The second thing is the surface bacteria, which is on the facial skin. And the surface bacteria thrives more on oily skin than a drier or less oily skin. And any increase in bacterial density or surface bacteria does lead to higher risk of higher incidence of inflammation and hence inflammatory acne. And last but not least, the other main causation of acne is the sebaceous oil secretion, which means the more active your sebaceous glands are, the more oily secretion that it produces and discharge, the more likely that the pores can be clogged because of sebaceous oil production and lead to a higher density of skin surface bacteria. So increase in sebaceous activity or oily skin tends to have higher risk of acne. So these are the three main causative factors of acne. And once you understand that, it's very easy to go into the treatment because most of the treatment that doctors do is to address one of the three or in combination, treating more than one factors. Let's go for the first one, which is your clogging up of your pores, leading to a blockage and inflammations and such. So you often hear about doctors talk about exfoliations. We have creams and oils and treatments to exfoliation, which means cleaning up of your skin surfaces to reduce clogging up of the pores. This involves topical ingredients such as salicylic acids, retinoids, and so on and so forth, and treatments such as microdermabrasions, chemical peels, and such. And even simple daily routine like facial cleansing, mask, simple exfoliation with peels does its work as well. And often you hear doctors advising to do those techniques or some of those regular routines. Next is the surface bacteria, which often lead to inflammatory acne, the big and painful acne that may lead to scarring. That's where the doctor will concern when you look at your face and you have a lot of inflammatory reaction, inflammatory acne. And one of the main treatment that doctor will often use is antibiotics. We have the option of topical antibiotics when the condition is a bit more controlled, not so severe, or oral antibiotics when the inflammatory reaction is a bit more out of control. So by using antibiotics, either with topical antibiotics or oral antibiotics, we are treating your surface bacterial infestation to reduce the density or to reduce or to treat the inflammation due to bacterial infections. And if you can control that, then your inflammatory part of your acne will be treated, subsided, and we get better. And last but not least, the third part about sebaceous gland, oily material production on the face. Patients who have moderate to even severe acne flare-ups that doesn't respond to antibiotics treatments, exfoliations, then doctors often suggest the third options, which is to treat or control your sebaceous gland production. We have creams such as retinoids. We have oral medications which help to reduce sebaceous gland production. By reducing sebaceous gland production, will make your facial skin less oily, and therefore we kind of cut off or reduce the source of the blockage and the source of bacterial inflammation. It is a very effective treatment for patients who have moderate, even severe acne flares. There are certain downside in using this option, especially the oral medications to control your sebaceous gland, because what happens if your sebaceous gland is drying up? Then you're going to feel like your face is dry, your lips will be cracking, you may have dry eyes, and so on and so forth. So these are the precautions that doctors would need to go through with patients if they ever need to be started on this treatment. So are there any other minor causes or minor factors which may affect your acne flare-ups? Besides the three that I mentioned earlier, there are certain factors that may contribute to inflammation or flare-ups of acne. The main important ones are, for example, hormonal changes. For ladies, they often notice that during ovulation and menstrual cycle, there are certain times where the acne will flare-ups, and we have what we call pregnancy-induced acne, we have adolescence acne. These are due to hormonal changes that leads to acne flare-ups. Genetics, of course, I mean, if you are your family, your parents, your brothers and sisters are having moderate severe acne, chances are that you're going to be higher risk of having acne as well. And stress, medications, and any kind of medical conditions, steroid-induced, and so on and so forth, they may cause affect your condition of acne. Poor hygiene, whether or not you do proper cleansing, proper skincare, and so on and so forth. Other things such as, like, say, certain myths, for example, that chocolate, certain types of spicy food, there's not enough evidence, we don't have scientific evidence to prove that diet, especially mostly diet, does lead or affect the severity of acne. Now let's talk about adult and adolescent acne occurrence in Singapore. Based on statistics from National Skin Centre Singapore, it shows that 41% of adults seeking acne treatment have experienced acne since teenage. And in another research, acne occurs in at least 88% of adolescents from 13 to 19 years old in Singapore. And the most common type of acne among average teenagers are comedones. The study also shows us that there are mild acne occurrence in 51.4% of adolescents in Singapore. 40% of local teenagers have moderate acne. 8.6% of them suffer severe acne. I'm going to briefly talk about certain myths that needs to be debunked for acne condition. For example, sun exposure, sunbathing can help to improve symptoms of acne. Well, we don't use sun to treat acne, even though sun has antibacterial activity, but I don't think it's significant enough to be used as a treatment for acne. Very likely, you may suffer from sunburn and sun damage instead of having any improvements in your condition. So not really, we don't really kind of rely on sun or sun exposure to treat or improve acne. Acne toothpaste, I've heard a lot about the myth about using toothpaste to treat acne. While it may cause some alkaline irritations, eczema, it may or may not help to improve it, but there's no evidence that toothpaste can be used effectively against acne. Acne is formed by poor hygiene. While you can say that if you don't clean your face and you allow your pores to be blocked, we can increase the incidence of comedones and hence lead to inflammatory acne. To a certain extent, if you don't take care of your skin well, then there is a slight increase in chance of you having comedones or even inflammatory acne compared to those who take care of them well. There's some certain truth in it that skincare, good skincare, does help you improve or actually prevent against occurrence of acne. Acne doesn't form overnight. As I mentioned earlier on about the causative factors about acne, there are usually a combination of certain factors when the pores are blocked, inflammation, bacterial infection, so on and so forth. Due to all these factors or combination of these factors that acne is formed or there's any flare-up, it doesn't form overnight. Treatment has to be addressed over a period of time to reduce the risk of all these causative factors, which may lead to acne. Greasy food cause breakout. I heard that a lot. In general, like I mentioned, there are lack of evidence showing food contributes to the flare-ups or worsening of the acne control. such as greasy food, spicy food, chocolate, so on and so forth. So I usually advise on patient, it's up to you what you believe, but there's not enough scientific evidence to show us that these types of food does affect your acne outcome. Thank you for listening. If you have any questions, just email us. See you again.